Hello friends, welcome to the Poppers. Today we are going to discuss about the very important bit from the parental chapter, that is component used in the parentals. First of all, what is the advantage of the parentals? These shows the quick onset of action, then the other route of administration. These are bypass the hepatic first pass effect, which is common problem occur in the oral routes of administration. Suitable for the nutritive like glucose and electrolytes, suitable for the drug which are not administered by the oral route, and suitable for the drug which are inactivated in GIT. These types of problems that are commonly occur in the oral routes of administration, and useful for the unconscious or vomiting patient, and useful for the patient who cannot take drug orally. And certain disadvantages like pain on the site of injection, such as mainly oily injection that show more pain than the aqueous solution or aqueous vehicle, or sensitivity or allergic reaction. These are the most common problem which are occurred during after administration of the parenterals. Difficult to reverse and administrated drug effects, and it requires the strict control of sterility and non-pyrogenicity than the other formation. If it is non-sterile or pyrogenic, then there should be no use in the parenterals, because these types of formulation we are directly injected into our bloodstream, and if it is not criteria that is non-sterile and pyrogenic, then inflammation and infection are commonly occur. For this administration of these parenterals, only trained person required, because we cannot have self-medication, and it have more expensive and costly product. The commonly used component of small volume parenterals are first of all vehicle, then antimicrobial preservative, antioxidant, buffer, tonicity adjustant, surfactant, suspending agent, bulk forming agent, chelating agent, complexation agent, and protein stabilizer. Coming to the next slide, that is vehicle. These are the more commonly used vehicle. That is 4 types of vehicle we can use. First of all, aqueous vehicle, second is water miscible, third one is non-aqueous, and fourth is a synthetic. In case of aqueous vehicle, the commonly used such as water for injection, sterile water for injection, and bacteriostatic water for injection. These are commonly used vehicle for the aqueous. Second one is water miscible. These are examples such as polyethylene glycol, glycerin grade 300, 400 and 500, then propylene glycol, ethanol. And next is a non-aqueous, in which vegetable oils are used as vehicles. In synthetic case, that is ethyl oleate, isopropyl myristicate, and benzyl benzoate. These are the main 4 types of vehicle used, and these are the example. In coming slide, first of all, water for injection. These water for injections, these are non-sterile, and the solid content which are used, that is less than 10 parts per million, and these water for injection can be prepared by 2 methods, that is distillation and reverse osmosis. And the endotoxin levels should not be more than 0.2 and 5 endotoxin unit per ml. In case of pH, it should be maintained between the 0.50 to 7.0, and these should be pyrogen free, and they meet the USB pyrogen test. In coming to the next slides, sterile water for injection. What are the difference between water for injection and sterile water for injection? In case of water for injection, the preparation are non-sterile, but here sterile water for injection, the preparation are sterile, and the solid content which are present in water for injection, these are less. But here means sterile. In case of sterile water for injection, the water solid content is higher level than the water for injection, because there should be possible leaching of the glass of container. Here some criteria or same ranges given to the particles present in the solution. First of all, the solution containing less than 30 ml that are only acceptable when the total solid content which are present in that less than 40 ppm. In case of 30 to 100 ml, less than 30 ppm, and more than 100 ml, the total solid content is less than 20 ppm. And the endotoxin level same as water for injection, that is 0.25 endotoxin unit per liter. And in case of bacteriostatic water injection, here we can use bacteriostatic agent such as benzyl alcohol. They are acts as preservative, and here we can use 0.9% concentration. The pH is used for the 0.5 say 0.7. It should be meet to the USP sterility test. The container which can be used that for the multi-dose container, it should be having bacteriostatic agent, and the main point is that the multi-dose container is not more than 30 ml and required the bacteriostatic agent. And the some important point for vehicles, that here mineral soil cannot be used for vehicle because it should not be metabolized in the body. If it is used, then the problematic in body. And oily injection, that shows the more pain at the site of injection. And one of the advantages, oily injections are not required in preservative. And oily injection must be given to the only IM route. If it is given to the IV route, it forms or it causes the thrombosis. Here vegetable oils, in winter season the vegetable oils, that viscosity should be increases and that are effective to the syringeability. The syringeability means the syringe, in the syringe whatever amount are present, they are not coming from that syringe. And for this sterilization, dry sterilization is used for the that vehicles, not steam sterilization at a clue. Coming to the next slide, that is antimicrobial preservative. What are the anti-preservative? Preservative that are agent that prohibited or that reduces the growth of microorganism by killing or by static agent. Here in large volume containers we cannot be used preservative because they should be dangerous to the body and it prevent the microorganism growth. But the main disadvantage of the preservative are these are soft to the rubber closure which are present to the container. That's why this preservative that reduces the these rubber which are there, that reduces the preservative efficacy. The ideal characterization of these antimicrobial preservative are physiologically inert, non-irritating and non-sensitizing, inexpensive, easily availability and compatibility with the drug, and these should be effective in small concentration. And commonly example of these preservative are, that is phenylmercuric nitrate and Thiomersol 0.01%. These are usually bacteriostatic agent. Benzothonium chloride and benzalkonium chloride 0.5%, phenol or cresol 0.5%. That is, these are two used in the oily vehicle, chlorobutanol and parabutane used for antifungal. And there is some interaction with the preservative such as tuinity with the methyl and propylparaben is the major interaction. Oily injection that not be required, the preservative and cationic preservative interact with the anionic. Coming to the next slide, that is antioxidant. These are mainly two types of antioxidant, that is water soluble and water insoluble. In water soluble, such as sulfurous acid salt can be used, such as sodium sulfide, sodium bisulfide, sodium metasulfide, sodium thiosulfides. These are the sulfurous derivative. And second one is ascorbic acid and thiol derivative. In thiol derivative such as thioglycerol, thiolactic acid, thioglycolic acid, these are used. And second one is water insoluble, that is oil soluble. These are propyl gallate, alpha tocopherol, butylated hydroxytoluene, that is BHT, and butylated hydroxyanisole, that is BHA. It is ascorbyl palmitate. These are mainly two types of antioxidant are used. Here antioxidant can be classified also as a reducing agent. Reducing agent means they acts by oxidized and gradually used, such as example of sodium sulfide and bisulfide, water soluble, and chain blocker by they are used by blocking the oxidative chain reaction Example, propene gallate, BHA, BHT. Coming to the next slide, that is tonicity adjuster. Tonicity adjusters are electrolytes and non-electrolytes. In case of electrolytes, used as sodium chloride, and non-electrolytes, that is glucose, mannitol, glycerin, sorbitol used. Solution that are not an isotonic, that is non-isotonic, is called as paratonic solution. For the tonicity adjustment, we are used commonly electrolytes such as NaCl, used as 0.9% concentration, and in case of dextrose injection we can use 5%. Isotony is an important criteria for the intravenous and intradermal and intraspinal, but not for the intramuscular and subcutaneous. And finally, the tonicity can be measured by the two method, that is osmometer and fragility point. In this osmometer, osmolarity of the blood is 250, and in case of fragility point, the concentration of the isotonic solution of NaCl that just causes the hemolysis of the suspension, or the concentration of the hypotonic solution of NaCl that just causes the hemolysis of the suspension of RBC. And coming to the next slide, that is use buffer. Buffer, what is meant by buffer? Buffer is that resists the change in pH of the solution, and these also useful for the increase the stability of the product. The common advantage or common use of the buffer are for enhancing the stability of the drug, for physiological compatible, for enhancing the physiological activity of drug. However, the buffer used for injection must allow the body fluid to change the product pH after injection. Buffer are not used here. Buffer is also not used in the large volume parenteral. Examples of buffer such as citrate buffer, acetate buffer, and phosphate buffer. Next slide, surfactant. The commonly used surfactants are polysorbative, that is Trinity. These are the non-ionic surfactant, and non-ionic surfactant we know that they have low toxicity and lesser incapability. Next is suspending agent, that is methyl cellulose, CMC, that is carboxymethyl cellulose, and polyvinyl pyridyl, that is PVP. They impart the viscosity. In case of emulsifier, lecithin is used. Insulating agent, disodium EDTA is used. Why? Because they bind heavy metal and catalyze the oxidative degradation of drug. And coming to the complexing agent, 2-hydroxypropyl bicyclodextrin is used. This is also used for complex agent for increase the solubility, and protein stabilizers, that is amino acid and polyvinyl pyridine used for the stabilized protein. And last one is bulking agent. What we need to the bulking agent here, because they increase the solid content of the freeze-dried product, and they are water soluble and provide the porous solid mass from the easy dissolving. This bulking agent can also be used to the strength of the cake which are formed after the freeze time. The commonly used bulking agents are mannitol, lactose, and sucrose. And thank you. For more videos you can log on www.pharmatopus.com.